Imagine knowing you're dying, knowing that you have a terminal illness and there is no cure. Treatment isn't working and the pain is just getting worse. I worked in a nursing home for 4 years. I've seen a lot of people's end of life moments. Some people just pass peacefully, sometimes with their family there, sometimes just in their sleep. But there was one woman that came in. She had cancer. They had only gave her, 4 months to live. I can't exactly remember what kind of cancer she had, but I do remember her. I remember her family coming in every single day, trying to keep her comfortable. I remember staff working hard as we could to keep her comfortable medically. I also remember how every day she would tell us how much pain she was in and that the pain was just getting worse and it was just getting unbearable. And I remember at about 3 weeks, she had passed away. And it was one of the hardest things that I had to go through and see because she didn't have any options. She could went to hospice, but other than that, just coming in with us and just trying to make her as comfortable as possible is what she done. But I believe terminally ill, sound of mind patients should have a choice. They should be able to choose physician-assisted end-of-life care. Yes, there are other options. There are, extensive treatments. There is hospice. And I think that there should be an end-of-life option. The patients know they're suffering, and physician-assisted end-of-life care can give them the option to stop the suffering. But the choice has to be theirs. Nobody needs to force them into that. But choice does not mean no rules. There needs to be strict safeguards and policies. They need, terminally ill, 6 months or less to live, being sound of mind, being able to make decisions on their own. They need to have multiple requests. It shouldn't be something that they just make on a whim. There needs to be multiple doctors involved. And they need to make sure that they know that they can change their mind. That they can make this decision, but when it comes down to it, that they can choose any other options. Oregon Health Authority, with the Death and Dignity Act, states exactly that they must be 18 years or older, terminally ill 6 months, sound of mind, 2 doctors to sign off, and they need to have psychological care if they request it. But there are people that want there to be other options. The National Institute of Aging really focuses on hospice, and hospice focuses on comfort and quality of life. They help medically. They can give pain medication, and that is a great option, but sometimes it just isn't enough. The American Medical Association has completely different views. They believe that doctors are healers, that they should help the patients. They have a lot of concerns about the risk that maybe the patient is being forced into it by their family for maybe life insurance purposes, or that the patient may just feel like a burden to their family, that they're not able to take care of themselves anymore. And them are all valid concerns, and I do understand. And I also understand how hard it is as a family member when somebody comes up to you and are like, I want to have the choice of physician assistant end of life care, to just be like, yeah, okay, that's fine. Like, I believe that the families also need to have psychological care available. Counselors, social workers, things like that need to be available to the family as well, because it is a big decision, but they have to know that the decision is ultimately the patient's. Physician assistant end of life care isn't for everyone. But if people can choose to stop chemotherapy, to stop pain medications, to stop any other kind of medicines that they may be on, and they also have the choice to change doctors if they want to, they have those options. So why are we not giving them an option to end their suffering? If they are sound of mind and they are confident and they can make medical decisions, then why is that not an option? The decision should be the patient's. We don't get to choose whether every illness can be cured. But when there is no cure, I believe people deserve some choice in how the final part of their life looks. They should have choices, whether it be hospice or going to a nursing home or going home. They deserve the option. Thank you.